Welcome everyone to our ongoing series looking at the economic impact of COVID-19. If you're just joining us, I'm Marko Vujicic. I head up the Health Policy Institute. I'll be leading the webinar where we're looking at data from last week, which is a first look at the reopening of dentistry. So April, to say the least, was a tough month. For many, many reasons. Personally, professionally, we've all been adjusting. But for the dental care sector and the US economy in general, it was nothing short of devastating. So these are a few stories that were published this weekend. I had the privilege of being interviewed for them. But they're basically showing that, and our data confirmed this as well, there were massive job losses in the dental care sector last month. Here's dentistry's employment trends on the top left. You see an absolutely unprecedented drop there in April. So roughly 500,000 jobs were lost in the month of April in dental offices. For comparison, the bottom left is physician offices. You see a couple other sectors of healthcare there. Dentistry was hit hardest among all healthcare sectors in terms of job losses. And again, we all know why that was. It's a voluntary delay of elective procedures based on recommendations from the ADA and the CDC. But we're here to talk more about what's happening last week. So on the top left, most states in April had shut down for elective procedures. But as of last week, we had 28 states that opened up for elective procedures. So we're going to do a big walkthrough of those data. And again, our polling is the basis of today's webinar. We've been collecting data since mid-March, every 2 weeks from thousands of dental practices across the country. As you'll see, our core questions are you open or not, i.e. what's the status of your practice? We ask about patient and collections volume. We also ask about whether you're paying staff. We have thematic questions of the week. We have very good response rate and high numbers. So this is a very representative sample of dentists in private practice. And I did want to flag that last week we started recruiting dentists in public health settings as well. So look for that in the coming week or two where we analyze those data. So here's where we were as of 2 weeks prior to last week, so 3 weeks ago. In April, roughly 3% of practices were open and 97% were closed for elective dentistry. And here's the big reveal. As of last week, we had 30% of practices open for elective dentistry. So nationally, 30% of practices were open last week. That compares to 3% 2 weeks prior. We do have a difference in who's opening in terms of age. This shows us that younger dentists, all else equal, were more likely to be open last week than older dentists. It's not a huge gradient, but it is a gradient. Next, we look at, the plan here is we're going to show the national data, and then we're going to do a deep dive into the 28 states that actually reopened. So the first part of the webinar is just the national data tracking, because it's valuable to look at that as well. And then the deep dive really into those 28 states that have reopened, we're going to do towards the end. So again, the Q&A box you'll see is how we'll be taking questions. That's the only way we'll be taking questions. We'll hopefully get to those. Adriana's going to help collate them and pull out common themes, so keep them coming. And again, this will be recorded and shared with you, as will the PowerPoints as well. Okay, the next question we monitor is patient volume. And you see there on the top half, that's that variable. On the bottom half of this chart, we also monitor the volume of total collections as well. So the blue and red bars mean that you're at very low levels, and the green and dark green mean that you're at higher levels of what is typical. So red and purple on the left are bad. It means things are very, very slow. And as you move to the right, things get progressively better. So we did see a bounce back last week in the patient base. So if you do a weighted average, basically nationally, again, this is across practices that are open as well as closed, etc. This is a national number. Patient volume last week in the US was on average 18% of what is typical in dental practices. Prior weeks in April, it was much less. It was around 7 or 8. So we have seen a pretty appreciable, in my view, week 1 increase in patient volume. Collections as well, not as robust. There's a little bit more red there versus green. But again, we are seeing some bounce back in patient volume. One of the insights we also got, if you've been following our work, is that there are differences in both how acute the shutdown was, how much teledentistry was used, all sorts of differences by practice type. So we're seeing that actually remains. So not to go into the detail, these data are all online as well on our reporting page. But larger groups last week did see a slightly bigger bounce back in patient volume and collections than solo dentists, for example. We're picking here the two extremes in terms of practice structure. But these differences have persisted throughout our polling. So while this is not a new finding, the data last week do confirm that large groups have I guess done slightly better during this downturn and the reopening last week compared to solo dentists. The third question we ask is about paying staff, and again the data from last week are on the bottom here, and this is a pretty appreciable bounce back in hiring of dental staff in offices. So again, in April, only about, let's say, 10 to 12, 13% in our latest wave in April, 13% of practices were fully paying all of their staff. That actually jumped up to 33%. So last week, we were already at a situation where a third of practices had basically hired back all their staff and were paying their staff fully. So quite some encouraging news in terms of the national data on the week 1 bounce back. Okay, one of our questions of the week last week was focusing on non-owner dentists. We've been asked a lot about, well, what's happening with employee dentists versus owners. So we were able to get very rich data on this. What these data are showing is that among non-owners, i.e. employees, independent contractors, and associates who were not owners, still last week, more than half were not being paid at all. Now, the bottom panel shows that among those not being paid at all, more than half had been receiving unemployment benefits. But our insight here was that the layoffs in April that still seem to be lingering, at least when it comes to employee dentists, are quite acute and quite severe. So even in the first week of reopening, we're not seeing a huge hiring back of dentists, certainly not to the extent of other dental team members in offices. And I think some of the richest data that we've been collecting, or that we did collect last week, relates to the availability of PPE. This is obviously a major issue. This is something the ADA has been working heavily on the past weeks with various government agencies and other avenues trying to secure PPE for dental care providers. But here's the situation. So we asked about the availability of these 4 types of PPE, and we asked how many days supply do you have in your practice at this time. So as of last week, 31% of dentists reported that they have no N95 masks in stock. Another 29% reported they have a week's worth in stock, and only about 1 in 6, far right on the green, reported that they have at least 2 weeks worth of N95s in stock. Surgical masks, again, much more ample supply, but still there is a small sliver of practices there in red that also don't have any surgical masks. Again, to emphasize, these are national data. This is not controlling for whether you're open or not. We'll get to that in a second. But this is just a great little snapshot of what's in stock currently across practices in the US, a representative sample. And as you move down, face shields and gowns, you see the data there. So an insight we took from this was that N95s and gowns seem to be in particularly short supply, but face shields as well, 1 in 6 dentists reporting they have none in stock, but definitely variations there. The nice thing is we have these data state by state for almost all states. If you're large enough, we have sample size in the vast majority of states. So online, you can go look at the PPE supplies state by state. Here I just pulled out 2 states that are on different ends of the spectrum. So here's Washington. Washington, the majority of dentists report not having any N95s in stock. And as you go down, kind of ditto for face shields and gowns, much more acute shortages. Then in comparison to a state like Georgia on the bottom, where you have more green bars and less red bars. So there are variations by state. Again, we've just started looking at all these data. We've shared these data with the state dental associations and other stakeholders, but they're all online. You can go look at ada.org/HPI, look at our COVID page and look at Wave 4 results. But anyway, now Washington happens to not have reopened last week, and Georgia happens to have reopened. But this is a real interesting chart. So many of you are probably asking, well, what does PPE look like in practices that are open versus those that are closed? And here are the data. So on the top left, we've looked at practices that were reopened as of last week. And on the bottom right, we looked at practices that have remained closed. And here we're looking at PPE supplies. So a couple of insights we gained from this analysis, comparing kind of the length of red bars, so to speak, in the top chart to the bottom chart. We do see that practices that have reopened do have more PPE in stock than practices that have closed. That's probably a result we all expected. However, there are practices open that I would say probably have less PPE maybe than desirable, or at least in comparison to maybe what again, different guidelines allow for, they're not as prescriptive. The ADA guidelines, accommodate for risk assessment and judgment for what PPE is appropriate in what circumstances, what is not. So it's not like there are hard written rules for all this. But as you'll see later, the N95 masks are important for dentist perceptions of risk. With that said, there are roughly 19%, so nearly 1 in 5 dentists who are open as of last week that don't have any N95s in stock. But again, I guess one of the encouraging things is that there is a relationship between the availability of PPE and whether you are open or not. The other thing we asked last week was general levels of concern. So on a scale of 1 to 5, please describe your level of concern regarding the risk of transmission and COVID in your practice to your patients, to the dental team, and to yourself. So these are dentists reporting their perceived concerns about risk of transmission to their patients, to their dental team, and to their self. And the red is very concerned, and the green is not concerned at all. So you can see where these temperature scales shake out, roughly neutral to moderate, right? So, you know, there is some concern. We're in the orange band, for example, on the far right. There's moderate concern among dentists regarding transmission of COVID-19 to themselves, their patients, and their teams. So we're going to dig into this a little bit more. Interestingly, we did not find appreciable differences in risks in concerns with risk of transmission by specialty type. So, for example, there's not a lot of variation at all comparing GP dentist, endodontist to pediatric dentist, etc. There's fairly uniform assessments and concerns regarding risk of transmission to dentists across specialty. There are differences in concerns with risk of transmission by age. So older dentists are most concerned with transmission risk of COVID compared to younger dentists. And again, that could be related to risk factors and comorbidities and all that we've learned about the transmission and who's most vulnerable. But this is a very interesting one as well. There's a big variation in perceived risk of transmission according to whether you're open or not. So what we've done here is we've taken those reported the questions about how concerned are you with risk of transmission to yourself, and we've analyzed them according to whether the practice was open, which are the top two bars. And when we say open for elective procedures, which is the top two bars, versus practices that are closed, which is the bottom two bars. So again, what these data are looking at is how concerned are you with risk of transmission of COVID to yourself, and we're looking at it according to whether you're open or whether you're closed. And what these data are showing quite strikingly is that there's far less concern among dentists about transmission of COVID to themselves among those dentists who were open last week compared to those that remained closed. So the practices that remained closed last week generally have a much higher concern about transmission risk than the practices that have opened. Now, these are interesting, but they don't tell us everything. So there could be various hypotheses going on. For example, it could be that the practices that have opened have much higher stockpiles of PPE, and hence that's helping alleviate the risk concerns. And the practices that have closed are the ones that lack PPE, and hence they may perceive their risks to be higher. That could be one factor. It could also be that the practices that have opened are located in what we might consider fairly low-risk counties or low-risk areas in terms of low prevalence of COVID or low fatality rates, you name it, right? So definitely there's a lot of variation geographically in the spread of COVID among the population. So it could be that practices that have opened are basically all congregated or located in low-risk areas. It could be that as well. It could also just be differences in attitudes and perceptions. It could be that the practices that are, let's say, the early openers last week may simply have a different perception or attitude to risk, kind of like, okay, this is less of a big deal maybe than we thought. And those that have remained closed might just be the extremely risk-averse dentists that are waiting for better science, weeks and weeks of PPE supplies. We don't know. So we've just started looking into this, and there's obviously a very rich research agenda. But the first thing we wanted to look at was concerns about risk of transmission against your supply of PPE. In this case, we just picked one, the N95 masks. And we do see a relationship here, right? We do see that the practices that have no N95s in stock, which is the top bar, they tend to have, the dentists in those practices tend to report a higher level of concern with risk than the practices, let's say on the bottom, that have much higher supplies of PPE. So what these data are telling us, in our view, or at least suggesting, is that dentists with bigger stockpiles of N95s express less concern when it comes to the risk of transmission of COVID-19 to themselves. But PPE is not the only thing driving this. And I think this is a really important insight we gained, and let me walk through what's on the screen here. So what we're doing is we're taking practices that are open last week on the top, and we're comparing them to practices that are closed on the bottom. And then what we're doing is we're actually controlling for the level of PPE. So we're going to adjust for that factor and kind of make it all else equal. So if you just look at what we highlighted with the red arrow, right? We're taking dentists in practices that have no N95s in stock. And then we're going to compare those that have opened versus those that have closed. So again, we're controlling for the level of PPE, in this case N95s. And what I've highlighted as an illustrative example is we're taking dentists that have no N95s in stock, and I want to compare those that have opened with those that have closed or remain closed. And then I want to look at how they're perceiving their risk. And here you see a dramatic, almost fourfold difference. So basically, dentists who have opened without N95s are reporting a pretty low level of concern compared to dentists that remain closed and have no N95s. So again, what this is suggesting to us is that dentists who have opened are less concerned about transmission of COVID compared to dentists who remain closed, controlling for PPE stockpiles. So this suggests dentists differ in attitudes and assessments of risks. And it's not just that PPE is the only thing driving the perceived risk. Now, maybe to dentists listening in, this is not an important finding. And of course, there's variation. But I think what this is showing is that maybe the early openers just have a different attitude than the ones that have remained closed. That could be, we're not saying that definitively, but the data are suggesting that. We have not looked at the geographic location of open practices versus closed practices yet. What we're going to do is we're going to pull in the epidemiology data, and we'll look at incidence rates of COVID among the population, and we'll be able to see the extent to which the opening of last week is focused in, let's say, low risk geographies, just because COVID is not really, let's say, prevalent among the population. It could be that. But anyway, some very, very rich insights in these panels so far. We're going to now do a deep dive into the 28 states that have reopened. Those are the ones that are in green here. But actually, before I go into the results for those 28 states separately, let me turn it over to my team, Adriana. Is there anything you deem pertinent, relevant, interesting at this stage in terms of the Q&As that we may pause and take?
Hi everyone. Good morning. I think we could wait until the end, Marco. A lot of the questions that I'm answering individually are related to PPE guidelines, so I'm directing folks to ada.org/virus for the latest guidelines from the ADA. But I feel that most questions would be better suited for the end at this time. Great.
Then let's keep going.
Sounds good.
Okay, so in the 28 states that have reopened, we classify the open states into two categories. In the end, these categories are not that meaningfully different, but we didn't know that until we did the analysis. So we classify states here in dark green that have, in our view, fully reopened, in a sense that all procedures are now allowed. And again, there are, as Adriana mentioned, there are ADA guidelines and toolkits that help dentists assess kind of what PPE they need, what new protocols they need. Those are available, as Adriana mentioned, at ada.org/virus. But looking at the recommendations either of the state agency or the state dental association, we coded states as either everything's back on the table in terms of procedures, or there are some restrictions, which is the light green, which would say things like, limit the volume of aerosol generating procedures or things like that. These classifications of reopened states are not conditional on PPE. Every state has some recommendation about PPE guidelines, and most are following the ADA guidelines, which is great. But anyway, in a nutshell, the green states, as we're going to look at now, the dark green states would be the top bar, states where all dental procedures are allowed. The light green states would be the middle bar, which is states where most procedures are allowed, but some restrictions. And then the states that have remained closed for elective care are in the bottom bucket. So you'll hear me talk about these top two bars kind of together because there's not really that much meaningful difference. So 28 states have reopened, the rest have not as of last week. That's changing this week. But here are the data. So about half of practices have opened actually in the 28 states that have reopened for elective care. So this is important. So in week one, it's not like we saw all practices reopen, right? We've seen about half in those 28 states actually reopen. That's the green and yellow there. And again, the states that remain closed obviously remain closed. In terms of total patient volume, this is a really important statistic, right? So now we're looking in the 28 states that have reopened, okay, that's those top two bars. And we're looking at what does patient volume last week look like compared to what's typical in those practices. So you see here, there's a dramatic reduction in the purple and red zones compared to like the yellow and green, right? So when you do the math and take a weighted average, you get 28%. So what does that mean? That means that in states that have reopened, patient volume last week was 28% of what is typical. So just over a quarter. So in my view, for a week one bounce back, I mean, that's very encouraging. That's showing there's life seeping back into the dental economy. Patients are coming back, not in a tidal wave, but certainly I would say more than a drip drip. So these week one data, in my view, are quite encouraging. Collections not as huge. So in states that have reopened, the volume of collections was, that's a typo, we'll fix that, it should be 20%. So patient volume in states that have reopened is 28% of typical levels, and collections are at 20% of typical levels. In terms of paying staff, I think this is probably one of the most encouraging parts here. Remember that April jobs report that came out on Friday for BLS. Our data for April were devastating in terms of layoffs and the kind of job losses among the dental team. These data here are quite encouraging. So what they're showing is that in terms of states, in states that have reopened last week, again, those 28 states, nearly half of practices had hired back fully all of their staff. So again, that is quite a bounce back in hiring. And this is one of the things I tried to raise with the journalists was, frankly, we had early insights into what's happening the first week of reopening, and they're showing, quite a bit of bounce back in terms of hiring. So definitely expect the May job numbers to be much better. Okay, and then just to highlight a couple states, again, on our webpage, you can find very rich state-by-state data for all states. Frankly, we're just starting to analyze all the variations. I just picked 2 states here to walk you through kind of what the data show. And one of them is Arizona. So let's look at Arizona's reopening. This is pretty dramatic reopening. So a lot more than half. So I'd say 70%. 70% of practices in Arizona last week were open for elective procedures. So remember, the national data showed that about 30% of practices nationally last week were open. Again, that's across states that are closed and open. But here, looking at one state that is reopened, 70% of practices reopened, which is a lot. And again, here you can see the bounce back in patient volume and collections. That blue and red bar is shrinking for the week of May 4th, and we're seeing more green. So in fact, what this shows that, in fact, the majority of dentists in Arizona last week were reporting, well, no, that's not right. So 35. So more than 1 out of 3, right? I'm looking at the green and the dark green. So 36% of dentists in Arizona last week were already at half or better in terms of their patient volume. So they had bounced back. More than a third of practices in Arizona have bounced back to a point where their patient volume is at least half of what's typical. And collections you see on the bottom. Again, hiring is strong. 56% of practices in Arizona had fully hired back all their staff. Here's the PPE situation. Again, I guess 1 out of 6 practices, dentists are lacking any N95s. 1 out of 5 are lacking gowns. And you see the face shields and surgical masks there. And now let's look at Texas, another state. So here again, not as many practices open, but just over half of practices in Texas reopened last week. Remember, in Arizona, it was about 70%. Here's the PPE situation in Texas. Let's go to volume. Here's the patient volume in Texas. Not as huge of a bounce back in Arizona. If you remember, the Arizona purple and red were much smaller. But still, I mean, pretty appreciable increases in patient volume in Texas. And in terms of hiring back staff, again, pretty encouraging numbers, not as dramatic as Arizona, but certainly non-trivial in our view. So let me zoom out and give kind of the key big picture takeaways. As you can see, obviously very rich data. We just finished data collection midnight last Thursday, and we had these data online on Friday. And quickly put this together. But in my view, I'm really proud of the team in terms of bringing a huge data set together. We obviously still have more analysis to do, but we've already gotten some pretty rich insights in terms of week 1 of reopening. So there are 3 I'd like to highlight. So in states that have reopened for elective care, more than half of dental practices were open last week. Practices were hiring back staff. Patient volume bounced back. After a tough end of March and April, the dental economy showed signs of life. PPE shortages are constraining reopening, but they are not the only factor. Dentists' perceptions of and attitudes toward COVID-19 transmission risk, independent of PPE availability, are partly driving those reopening decisions. And I guess the coming weeks are important. They will provide much more robust data as more states reopen. In particular, patient volume trends will shed light on the degree of recovery. In the meantime, week 1 reopening data support cautious optimism. So obviously, in 2 weeks, we go into the field again next week. And in 2 weeks, we'll have another webinar and another update. And I guess we'll see how much of this week 1 bounce back was the leading edge of an accelerated path forward, or whether it was pent-up demand that maybe will stop. So don't want to speculate on that. We'll know soon enough in 2 weeks. But in the meantime, we're going to take a cautiously optimistic approach here in terms of the early signs of recovery. So that's it in terms of the walkthrough of the data. And as I mentioned, we are doing more research as we speak in terms of some of these other hypotheses. And you can get the state-by-state data at ada.org/HPI. So Adriana, let me turn it over to you now and walk us through some of the questions.
Yeah, thank you so much for all the questions. They keep on coming in. We'll do our best to address most of them. And we'll follow up with you individually if we are not able to address all of them during this Q&A session. So Marko, the first question is a clarification question. When you're reporting open versus closed results, the open results, are those for states that are allowing all procedures, or does that include reopened states that have some non-PPE related procedure restrictions?
So I think for that, we're reporting both. Let me just go back here. We're reporting for both, but at the end of the day, the data are very similar. So when I'm saying open during, for example, this slide, I'm talking about the top 2 bars, which are both of those categories. The states that have fully reopened, all procedures allowed, plus the states that have opened with some non-PPE related restrictions on procedures. At the end of the day, there's not much difference in what's happening in those states. But I apologize if I confused folks. When I've been saying open, I'm talking about the top 2 categories, which are states both that have reopened fully with no procedure restrictions, as well as those that have opened for elective care with some non-PPE related procedure restrictions. So basically this 28% is actually the same weighted average across both. So the numbers are virtually identical. So that answers that question. Yeah.
Okay, great. The next question is a compilation of several questions. Is there any data about actual disease transmission in the dental practice?
So that's a great question. And we've gotten that in all of our webinars. So not to our knowledge yet. So what we're doing together with our science group in the ADA and HPI, we're collaborating to try to kickstart some analysis in this area. And it's important, I just want to say kind of what roughly those 2 avenues are. So last week we included, and I didn't present the data, we included a question on our survey asking dentists if they'd be willing to enroll in exactly that type of study, where we would ask them about transmission or cases in their office of COVID, and you know what they're doing outside the dental office in terms of behavior, as well as any comorbidities and risk factors. I would call it a dirty epidemiological study, but we can't let the perfect be the enemy of the good. That's one avenue we're pursuing. We're also discussing with the authorities, mainly CDC, if there's scope to, through the surveillance systems, data collection efforts, get some more granularity on occupation. So right now, I'm sure you've seen there's reports of COVID cases among healthcare workers. But there isn't reports specific to type of healthcare worker. It's just one aggregate category. So we've been having some discussions trying to see if we can, and others support this too. This is not just a dentistry thing. There's lots of occupations that would like to have those data. But we're pretty confident that in the coming months or weeks, maybe even, we'll have some solid analysis on that. In the meantime, it's just anecdotes. I mean, there are some practices that are large that have told us we've been seeing emergency cases and we have no cases of COVID transmission. But again, those are one-offs and they're anecdotal and we don't know what's going on there. So look for that research. The ADA is on this, but we don't have anything to report now. But while I have you, if there's anyone else that has ideas or data sources, please also suggest those in the Q&A box or reach out to me directly at hpi@ada.org.
Okay, thank you, Marko. Another question, or several questions came in related to, is there any data now pertaining to the procedures being performed as practices reopen?
Another great question, right? Like what type of procedures are actually being performed in week one? Unfortunately, we don't have data that's that timely. We have a lag. But I will reach out to some other research groups that may have those data. And hopefully, let's see, maybe if we can answer that in 2 weeks.
Okay. Any update on the sentiment of patients returning to the dental practices?
So that's an area that we are actually this week pursuing, and within the ADA and potentially some other partners to field some research about that. There have been, well, there's at least one study I know of, not done by us, but it was out of North American Dental Partners. That was to me quite scientific. That did suggest some concerns, and it indicated the consumers or households would like to know whether dentists are following the appropriate guidelines. They would like to know whether there's been a case of COVID in the dental practice. But look, in my view, we have only started scratching the surface of this. And let me tell you why we haven't fielded that kind of research yet. We actually wanted to wait to see what some of this early reopening data showed. So in my view, it has showed that there definitely are segments of the population willing to come back to the dentist now, right? We'll see in another 2 weeks whether we've seen bigger bounce back, whether we've seen a smaller bounce back compared to the week one bounce back. And then I think based on that, we probably will decide exactly what we want to do in terms of, you know, you got to remember, right? There's a healthcare shock here in terms of a pandemic, and then there's an economic shock with 14% unemployment and what some are predicting 20% right up the road. So I think for us, we're kind of waiting a little bit to see what these early data show, because obviously I think, you know, if the clinical / pandemic concerns are dominant in terms of potentially keeping people away, that's very different than if it's more the economic concerns. I lost my job, I lost my coverage, etc. But look, we're going to want to know that. We're just assessing the timing of how to do that. So in a nutshell, I think there's been some quick research done. I don't think it's definitive. And we'll have more to update on that in the coming weeks.
Okay, thank you. Another question. You forecasted dental care would decline by half or worse this year, or a couple weeks ago. How is that changing given this new data?
That's a great question. So we are very clear that we're a little bit shooting in the dark and this is our best guess. So we are likely going to be updating that. It's a question of whether we do it now or whether we wait to see what the wave next week looks like. I'd prefer to do that to see if we're seeing like an accelerated bounce back versus maybe this, again, think about early adopters in the population willing to go back and maybe we've stalled out. But we always intended to update that. So yes, we will be. Honestly, given these week 1 data, those projections were probably overly bearish. But we were very transparent about that. So yes, we likely will be updating those.
Okay, thank you. Somewhat related, what's the expected loss of production in the first 3 months of opening based on the early weeks of data?
So that you'll have to join us in 2 weeks. So we will have 3 weeks worth of reopening data, and that'll help us maybe refine some of our projections. So let's take that question for future. Tough to kind of do the numbers on the fly on that now, but we heard you loud and clear. Yeah, thank you.
Okay, now there's a large number of questions that I'm still trying to see if there's a common theme. So I'm going to jump back to the very first question that was submitted, which is, I feel is a great one. What, if anything, surprised you in this week's results?
I would say 2 things. I would say the strong, the strong bounce back of patients. I mean, we called it cautious optimism, but to be frank, I wouldn't expect that we would return to 18% of typical volume in literally the first week of reopening. I may have been off base there. Maybe dentists were like, yeah, my schedule's full, can't wait to open. We heard a lot of those stories, but that was one thing. The other thing was the nuances and the variability in how dentists are perceiving this risk. I think that was a really, really important insight we got here. I would have thought that, okay, the PPE is going to be driving the risk, and once you stockpile that, a lot of dentists will have comfort. That's kind of not what we're seeing. We're seeing some really be on the risk averse and express high concern, even though they have lots of PPE on stock. And we've also seen dentists that I would say maybe have I don't know what the right word is, maybe a much more measured or relaxed attitude toward the risk. So I think it's important to not kind of paint dentistry or dentists with like a uniform brush in terms of how they're perceiving this. Again, we also saw lots of variation by age in terms of older dentists having, let's say, much higher concerns and anxiety. And honestly, that to me potentially can link to things like, early retirement and will I close, right? So that's something we want to be monitoring. That's probably not a week 1 type of decision, but I don't know the extent to which this may cause some, I don't know, particularly older dentists, maybe in areas that, like Illinois is having a tough time flattening the curve, right? So maybe in settings like that, where it looks like it may be longer until reopening, and if I can't get PPE and I'm individually at higher risk, maybe I should just exit. Now look, I'm projecting to what a consequence may be, but back to the question, those are 2 things, the bounce back volume, as well as the high degree of variability on the spectrum of concern. We definitely have practitioners that I would say are very concerned about their own health and safety. And on the other end of the spectrum, some of the early openers who are not. And I think an interesting related to one or two questions ago was like, okay, how does this all translate to like transmission or infection rates, right? You know, I don't know, but we'll know. We'll know in at least the coming months. But we're trying to get some of those epidemiological data sooner than later. Because another well, let's go on. I'll come back to that later.
Okay, I'll read two questions that are related, Marco. Do you know how much of the additional hiring can be attributed to the federal small business loan program? And then another question is, I think the main reason that you're seeing an increase in the rehiring of staff to their full-time positions is because of the PPP loans most owners received. Do you agree?
Yeah, so let me remember. So we went through those data 2 weeks ago. So as I recall, and correct me, Adriana or Sylvia, if I'm wrong, I recall about 3/4 of dentists had applied for PPP loans. And if I'm right, about half were approved. So I don't know, let's say roughly 37% of dentists received a PPP loan. Actually, I had Matt Michelson, who leads this research, look at the data on those dentists that received a PPP loan. To what extent were they hiring back staff? And they were, to a very large extent, right? At least partially, right? So the data do suggest, and we'll go back and look at this definitively. It's a great question. My take on the data so far is yes, that part of that rehiring is attributable to the federal relief. Exactly how much of it is attributable, I'm not sure, but that's actually a great research question. We'll look at that, and I'll be either post it on LinkedIn or send it out on next webinar in a couple of weeks.
Okay, so there's a mishmash of questions still to be answered, so I'll just start reading them one at a time. So unfortunately, guidelines, I imagine those are PPE guidelines, do not consider economic reality. Are the practices that are opening losing money for each patient seen if they discard masks and gowns for each patient?
Great question. So in short, we don't know. So I think what the question is getting at is to what extent do the new protocols, and I'm using all these words loosely, right? Everybody, their guidelines, their recommendations, protocols, but to what extent are those going to up the variable cost for dentistry? And they will, right? If you choose to, let's say, use the maximum level of PPE. We don't know how that's impacting the finances. And that's actually something potentially we could look at and maybe try to report back in the next 2 weeks. Because obviously it's driven by two factors, right? Is like, are you using additional PPE, yes or no, conditional on being open? And then what does that do to your variable cost? And can you offset that with additional revenue? Like, are insurers upping reimbursement because of increased costs associated with new guidelines? These are things the ADA is on, they're working on. We're trying, our dental practice and benefits folks are constantly in touch with insurers. They're trying to advocate, our DC folks as well, to try to get kind of the insurers to adjust. In many states, the insurers, have stepped up with some form of financial relief. I don't know how much of it is through enhanced reimbursement versus kind of these grants and loans. I'm not an expert on that, but it's certainly part of the equation. But we'll see, and maybe that's something we could dig into in a future wave. One thing I did want to ask before I turn it over, Adriana, to the last question, is I did want to ask you listening in, especially those that have heard us 2-3 times now, If you have suggestions for us for a question of the week in the next weeks or the next couple waves, please put those into the Q&A now. All right, you have a couple minutes till we sign off. But we'd like to hear your thoughts too about what you may think is important to ask. You now have a sense of what we're asking core questions and what our thematic questions are. So we welcome your ideas. But Adriana, let's do one more question.
Okay,
And
great.
by the way, if anybody's hearing jets in the background here, all three of us are in Chicago and the Blue Angels are flying around. So that's the reason.
Yeah, they
Nice
just
little.
flew over at my house now. I could hear.
Yeah, my kids are out watching in front of the
I
window.
know. I love them. Okay, so last question here that I'm gonna read. When we open, do we have any projection on what the demand for dental care will look like? After all, dentists have not been the only ones who have had financial strain. Will the general public have the discretionary dollars available to afford dental treatment?
We will have more info on that. As I mentioned earlier, we are initiating research in that area. I think the wave one data showed there's certainly a segment of the population willing to go back now. But this is the core question, right? There's the pandemic factor and then there's the economic factor about jobs and the financial situation in people's households. We modeled a pretty bearish, pretty conservative projection in terms of the economy not recovering till at least Q2 of 2021 based on the assessments we looked at that all the economists are putting out. So to me, this is going to be a slow climb still. But look, let's take the week one results as optimism. We'll come back with more refined research, but certainly in my view, there will be some new normal. But what level that stabilizes at, we're not ready yet to project. So let us come back in a few weeks with that. I think with that, we're right up on time. This has been fantastic as usual. The questions have helped us and they've also been really insightful. Here are the places you can contact us and see the results in more detail if you're interested. And thank you again. Stay safe, stay well, and we'll see you further up the road.